Welcome, everyone. Laura Wayman, the Dementia Whisperer here. I've had the honor of working with many couples who have experienced dementia along their long-term relationship journey, where one or both of the partners begin experiencing progressive loss and differing dementia symptoms. Dementia caregiving is all about managing loss and change. It's about learning to simultaneously witness and then grieve the daily losses, while at the same time developing new skills to handle the constant changes. There can be a lot of discomfort being on the early end of a learning curve of new dementia-aware skills, trying out new ways to manage behavior at the same time that you're grieving is something that no one ever expects to have to do at all, let alone for an extended period of months or even years. It's about learning how to make everything into your new normal, as opposed to stressing on how to attempt to do the impossible by reverting back to the old familiar normal. It's about recognizing and accepting loss of brain function and the presentation of dementia symptoms as early as possible, and not ignoring or staying in the short-term security and comfort of dementia denial. Instead, it is about becoming proactively dementia aware, looking deep into the progressive loss and changes over time, and being aware of the fact that dementia is not all about changes that occur with memory loss. Your spouse or partner or significant other may have difficulty remembering information, even if it's recently learned. However, presenting some decline in memory may just be the tip of the iceberg. Is your partner suddenly and uncharacteristically acting paranoid, such as accusing you of having an affair when it's not true? Are they unusually irritable, angry, aggressive, argumentative, verbally or physically abusive? Are they getting lost while driving or walking? Do they have trouble finding words in the middle of a sentence? Are they repeating questions soon after you've given them the answer? That can be so frustrating. When dementia happens to a marriage or any long-term relationship, it is about losing what may have been a long-standing partnership or a lifelong friendship. And now it's developing into more of a parent-child relationship. It becomes necessary to admit these personality and behavior changes will make the prior couple relationship end. So how does the healthy, significant partner learn to cope? Well, you keep in forefront of your mind that you can't stop it, fix it, or change the causes, the decline, the challenges. You can only manage them. You do your best to remain calm, confident, patient, and present with them in the moment, in the same way you would not get angry or frustrated with someone with high blood pressure or diabetes. Line up support, such as nonprofit crisis therapy, dementia-specific support groups for yourself, and invite all your family members. Pursue ongoing dementia-aware education and coaching, reading my book, as well as seeking out personal consultations with myself or other dementia-aware professionals and resources. These can be lifesavers. Practice appreciating and cultivating your spouse's current capabilities, what they can still do today, and work on stopping yourself from getting emotionally stuck or dwelling in lost capabilities, as sad as they are to witness. Accept that there may be a time when the care needs are beyond your abilities alone or resources that you have right now. As much as you know you can't stop the feelings of guilt later on for these tough decisions, it will be necessary to make them, such as maybe having to place your spouse into a out-of-home long-term care community. No, you can live in a way that has a good chance of bringing a sense of pride and peace when you look back and recognize you did the best you could, made all care decisions with the best of intentions and with the most educated awareness that ensured your loved one always received appropriate levels of care. Be sure and build your caregiving village. Ask for support from anybody that you can, family, friends, neighbors, professionals, and your medical community. When dementia symptoms happen in any committed relationship, there is significant emotional loss for the healthy partner as well. Here's some ways to approach these emotional losses, supporting you as the caregiver inside this amazing, mystifying, frightening, scary, hard dementia journey. Accept that your relationship is permanently changed and will continue to change. Continue to educate yourself, become dementia aware. Understand your loved one's changes in behavior are not intentional. Know that feelings of hopelessness and resentment are common. They're normal. Understand that intimacy will probably change. You could start a feelings journal where you jot down how all of this is feeling and be honest with yourself and open. Find a support group. Being around others who make you feel safe and where you can honestly share your thoughts and feelings can be so freeing. I'm doing my support group virtually and would love to have you attend from wherever you are. Email me at help@laurawayman.com for details. Be sure and try and focus on the positives. Check out more dementia-aware tips and strategies. In my book, A Loving Approach to Dementia Care, 3rd edition, there's a special new chapter about relationship changes that happen when dementia it rears its ugly head. My book's published by Johns Hopkins University Press, or you can visit my website, laurawayman.com.